Hi everyone, my name is Melvine Ouyo. I'm a reproductive health expert. My current assignment with Population Connection Fund is evaluating the impact of the Global Gag Rule in Kenya and the Greater East Africa. The Global Gag Rule actually limits access to reproductive health services, including family planning, by communities that previously benefited from these services. Organizations that previously would provide these services no longer do this because, for lack of funding or resources, they have had to cut down on their programs and activities, and they've also been forced to close down some of their facilities. They laid off most of their staff, and this has just left their clients stranded because they had contacts with these particular staff members and they had the trust in these facilities. But now this no longer happens, and this has really been devastating for communities and especially for young women because they have ended up with unplanned pregnancies, and this has led to early births, and most of them have had to even force or look for every means of terminating these unplanned pregnancies, which has resulted into unsafe abortions, a lot of morbidities, as well as mortalities.
Hi, my name is Sammy Luffy, and I'm the Policy Research Associate at Change, an SRHR advocacy organization based in Washington, D.C. While I'm sorry that we can't participate in the Capitol Hill Days event in person this year, I'm so grateful for the opportunity that Population Connection afforded us to have this conversation virtually. As many of you may know already, numerous studies from around the world have documented the myriad of ways that the Global Gag Rule limits access to sexual and reproductive health services. If an organization cannot comply with the Global Gag Rule, their subsequent loss of U.S. global health assistance funds can have disastrous effects, from forcing clinic closures to stifling partnerships and civil society dialogue, and even stalling country-level policies that would advocate and promote access to safe abortion services. It is well documented that previous iterations of the Global Gag Rule impacted reproductive health, including contraceptive access. When Bush's Global Gag Rule was in effect, contraceptive supply shipments to 16 countries across sub-Saharan Africa, the Middle East, and Asia were halted or reduced. Recently, The Lancet published a study by Nina Brooks and her colleagues concluding that Bush's Global Gag Rule corresponded with a decrease in contraceptive use and an increase in abortion rates, many of which were unsafe. It is important to note that Bush's version of the Global Gag Rule had applied to only international family planning assistance from USAID and the State Department, which is approximately $600 million per year. Trump's expanded Global Gag Rule, on the other hand, applies to all global health assistance, which includes about $9 billion just in U.S. global health assistance funds annually. This total, however, does not include funding by other donors that is also effectively gagged by association, including the funds from the Global Fund and other donors. In the future, additional research will be needed to build on Brooks's study, published in The Lancet, to document the impacts of Trump's expanded Global Gag Rule on global health, especially considering that the policy now impacts health areas including family planning, HIV and AIDS, maternal and child health, malaria, nutrition, water sanitation and hygiene, and others. With regard to Trump's expanded Global Gag Rule, Change has found that AMODEFA, which is the Mozambican Association for Family Development, did not comply with the policy and therefore lost 60% of its budget. They had to close 10 of its 20 youth-friendly clinics throughout the country and laid off 30% of its staff. AMODEFA also had to sever its partnerships with organizations that are in compliance with the policy. It also discontinued programs that provided tuberculosis, malaria, family planning, and HIV services. These are just some of the cuts that just one organization in Mozambique has been forced to make when it could not comply with Trump's expanded Global Gag Rule.
Hello, I'm Dickson Okong'o from Kenya. I work with a community-based organization known as Stretchers Youth Organization as the executive director. Stretchers Youth Organization is a grassroots youth-led community-based organization that was founded in 2011 by a group of young people. As an organization, we focus on promoting sexual and reproductive health right advocacy and also promoting civic leadership and good governance among young people to ensure that young people are meaningfully and actively involved in any form of decision-making and development processes in our country, Kenya. I would like to share some of the strides Kenya has made towards ensuring that we have got improved health facility in our country before the reinstatement of the Global Gag Rule in 2017. Kenya made some much stride in a way that even information about contraceptive, information about sexual reproductive health right was easily available or readily available to young women, to adolescent boys and girls within the community, because a lot of resources were being given, channeled to ensure that young girls and boys get this information that really they need to ensure that they live a healthy life. A number of organizations that offer family planning services and access to reproductive health services in Kenya get a lot of resources from foreign aid. And it means this organization has gone an extra mile to ensure that the clinics in the rural area, far to rich areas, and at the informal settlement. The reinstatement of Global Gag Rule really affected such facilities. For example, FHOK and Maristop were forced to shut down some of their clinics at the rural area, some of their clinics at the informal settlement. What does this replicate to young women and girls that used to go to these facilities? One, it means that these girls and women are now forced to go and seek these services in the public facility. And as we know, our country, Kenya, being a developing country, we still face a lot of challenges in our public facilities. Sometimes these girls go to this hospital, but realize that there are a lot of strikes, so it means they won't get the access to the services they are seeking. Then secondly, also sometimes they go to hospital, they don't get commodities. Now these girls, when they go to hospital, in the public hospital, they don't get these commodities. And secondly, we know that health sector is a very expensive thing in our country, Kenya. And most of girls and women live below $1 in a day. So it comes in between that buying food or going to seek health services. The other issue is that you realize, because now this organization had to terminate some of their staffs. So a number of well-qualified doctors had to be sent home now to go home because they're no longer job. So this really affected their family, because now this is a person that was depending on this clinic as a doctor and a salary, but now this person has got no salary.
The chilling effect is the undesirable restrictive influence or nature or effect that suppresses a speech or conduct of a constitutional right. And this is how it happens. For instance, the Global Gag Rule has led to disruptive coalitions and coordinations among the civil society groups, even the healthcare providers, because some of them look at other organizations or partners as carrying out activities that are prohibited. And this is how they look at the Global Gag Rule, as though gagged organizations are providing something out of the constitution. Yet we know that the Kenyan law states that abortion is not permitted except in the opinion of a trained professional, or if the life or health of the mother is in danger. And therefore, really, even the organizations that have been gagged basically are not doing anything outside the law. They're just providing services within the constitutional provisions. This has disrupted service provision, leading to limited access to healthcare, reproductive health services for most communities that really are in dire need of these services.
The chilling effect manifests when organizations or healthcare providers over-restrict their activities for fear of being found as non-compliant with the Global Gag Rule. The chilling effect can appear in numerous forms, including organizations self-censoring their speech, ending activities or programs unnecessarily, and avoiding participation in certain meetings or coalitions.
I can say that chilling effect is a situation whereby the government come up with regulation or laws that hinder you to talk or to do something or talk about something that you clearly know that you need to speak about it. I normally bring it close with the censorship, whereby you are being monitored in what you do. What you do maybe might have some repercussion. It happens when the government tries to pass some laws to bar people, I can say maybe the freedom of speech, to express yourself on an issue that you don't feel that you should be quiet about it, or when the government tries to bar you from doing something that you feel like if you don't do it, it affects your operation or it might affect somebody.
The chilling effect basically cuts across. It impacts on organizations, advocates, service providers, and beneficiaries of the reproductive health services. Because of the disruption, organizations can't just work together or in collaboration, and so they've had to work in silos, just being separated from other organizations. And it's really a terrible thing because some of the organizations have really been forced to even reduce or disintegrate their services, meaning that if an organization was previously providing family planning within other clinical services, say for instance, HIV and AIDS, malaria, TB treatment and care, this has now, for most organizations that have been gagged, they are forced to separate these services, that they no longer now provide integrated services. This is really harmful to beneficiaries of these services because it really makes them feel like, I don't need to go to this facility. If I go to this facility, I will be seen as though I'm going for abortion services. Yet that is not the case. This is someone who has been coming to this particular facility for HIV and care and treatment. Yet now, because this organization has been gagged, it looks like the only service one can get from this particular facility is just abortion. And this is really stigmatizing to these particular clients or community members.
The chilling effect happens when organizations are unclear about the full parameters of the policy because of ambiguous or insufficient communication from the US government or prime implementing partners. It has also been widely documented that local partners, who are often subprimes on US Global Health Assistance Awards, do not receive comprehensive or timely communication about how to implement Trump's expanded global gag rule. The resulting misinformation and confusion about the implementation of the policy makes it difficult, if not impossible, for subprimes to understand exactly how the policy applies to their work. The chilling effect can also impact healthcare providers who can over-implement the policy. For example, a provider could refrain from providing post-abortion care for fear of violating the policy, even though providing post-abortion care is not considered a violation. Most importantly, the chilling effect can impact the beneficiaries of U.S. global health assistance themselves. Beneficiaries can experience a lack of access to both comprehensive health services and health information depending on how organizations implement and interpret the policy. Throughout Change's research in this area and research conducted by other partner organizations in the SRHR space, we have documented numerous cases in which implementing partners of U.S. global health assistance are afraid to talk to each other, U.S. missions, or their own governments about abortion for fear of being marked as a troublemaker or perhaps an undesirable partner for future projects. Some organizations are even reluctant to pursue U.S. funding opportunities in the future because they believe other funders are reluctant to fund organizations that comply with the policy. The chilling effect also weakens partnerships and coalitions. Organizations that have signed on to Trump's expanded global gag rule can no longer participate in coalition activities related to abortion. During an interview with Change, a representative from a large international NGO that is the prime partner of a key U.S. global health assistance program in Malawi shared that staff from their organization have to run away from networks that advocate for abortion and cannot even attend meetings where people would advocate or even mention, in some cases, abortion.
Who the chilling effects impact and how harmful it is. I'll give it an example by this organization that have been focusing on contraceptive issues, sexual reproductive health rights, and family planning. So due to that, you realize that now we don't have that freedom to talk on our program, that it really affects a pro-choice organization and some of the youth organizations that focus on sexual reproductive health issues, family planning, and name it.
The current Trump's global gag rule makes the chilling effect worse than the previous version of the policy because it has actually created a disintegrated way of healthcare service provision in a way that there is no way you can separate HIV and AIDS from family planning or STI screening. And so this is how it makes it really worse, because the gagged organizations are forced to forego some of the services that they previously would provide so that they can just be able to sustain what they have, which is really a devastating impact on the communities.
Trump's expanded global gag rule makes the chilling effect worse than it has been in previous iterations of the policy because the current version of the global gag rule applies to organizations and programs that were previously exempt. It is apparent in Change's work that with partners in Mozambique, Zimbabwe, Malawi, and other countries that the current iteration of the GGR is made worse because of the political climate surrounding the Trump administration's regressive stance on SRHR.
As an organization, I can say that we have experienced the chilling effect in this way. You realize that currently our advocacy work has been limited. Now we can't go to the community and talk about issues about family planning in public domain, or we cannot do outreach activities the way we used to do in partnership with some organizations that were receiving grants to promote family planning. For example, currently when young people come in our office, we can no longer refer them to these clinics that we used to refer them because we are not sure of where they are going to go. So you realize also as an organization, these young people come in our office, they need our support. We know we need to support them, but our hands are tied that we cannot support them. So we are forced to send them just to go back home and find their own solution. So I can say it has really, really affected our work because we are seeing young people suffering, but we are not in a better position to support them and to see them come out of such situation.
To mitigate this effect, organizations on the ground putting strategies in place just to try and sustain their facilities or work. And what they have done, most have tried to seek new partnerships, which is really hard, but it is good that a few philanthropists are coming on board just to help sustain this organization. It is unfortunate that organizations have had to drastically reduce on their activities and programs, and this meaning that the main beneficiaries of these services then end up suffering as a result of this. It's also important that to note that from my interactions, everyone I met is crying out to legislatures, advocates, and any other person supporting the Global Act to really work to support this enactment of this law.
Change has conducted research on Trump's expanded global gag rule, including the chilling effect across numerous countries, including Mozambique, Zimbabwe, Malawi, and others. Overall, these studies conclude that under Trump's expanded GGR, civil society organizations, political, and advocacy voices are effectively gagged. In Mozambique, we found that some members of the Mozambican Sexual and Reproductive Rights Network have stopped engaging in coalition work and advocacy activities relating to abortion. Partners in Malawi told Change that Trump's expanded GGR has severely impacted the functionality of CAPUA, which is the primary coalition that advocates for safe abortion in Malawi. Coalition members who receive U.S. Global Health Assistance funds had to stop participating in CAPUA activities, including advancing Malawi's termination of pregnancy bill, which would allow for safe abortion services in specific cases. According to interviews with numerous CSOs, the U.S. government is seen as a big brother to the government of Malawi, and as a result, the government of Malawi is hesitant to pass any policy that would directly contradict policy and funding stipulations that come with U.S. global health assistance, including Trump's global gag rule. The Center for Solutions Journalism is a Malawian advocacy organization and member of CAPUA that directly engages with Malawi's parliament about the termination of pregnancy bill. Brian Ligomeka, the Center for Solutions Journalism's director, told Change that the former Minister of Health slowed the termination of pregnancy bill in Parliament due to its potential to negatively impact Malawi's relationship with the U.S. Representatives from iPass Malawi also reported that it's an uncertain environment for the government of Malawi to pass the termination of pregnancy bill given the existence of the global gag rule. Trump's expanded global gag rule has halted national progress toward abortion law reform in Malawi and has undermined both national sovereignty and legislative process. The chilling effect from Trump's expanded global gag rule spans from health service provision to coalition spaces and national legislative processes. Global health is only as successful as its partnerships and coalitions, which is particularly relevant today as public health actors at every level strive to address the COVID-19 pandemic. Any policy that weakens partnerships and coalitions will have far-reaching negative impacts that will trickle down from the policies through the programs to the beneficiaries themselves. It is our responsibility to continue to document the impact of Trump's expanded global gag rule on the health and well-being of beneficiaries around the world.
I would like to share how the chilling effect have really affected or impacted the lives of young people in my community. Currently, young people can't get access to reproductive health rights services as they used to get it. If I can quote a research done by Center for Reproductive Rights in 2018, it states that every day in Kenya, we lose 7 women based on complication related to unsafe abortion. So the number is very huge. Secondly, these young people now, they're not getting access to information on sexual reproductive health rights as they used to get because the facilities are no longer there with them. And now these young people are suffering silently, and it means that the economy of Kenya is going to deteriorate in future. If we are to achieve the sustainable development goals, then we really need to invest in the lives or in the health of adolescent girls and young women. And that is something that currently we are not doing. We are far away from achieving the sustainable development goal if we are not investing in the lives and the health of adolescent girls and young women. And young people, if are not meaningfully involved to discuss issues affecting their lives, if young people are not involved to discuss issues on development processes, if young people are not involved to make informed decisions, we are coming up with a future that will be full of a lot of problems. The evidence is clear. The denial of opportunity to provide young women and girls with information on their sexuality is really costing them their lives. And the Global Gag Rule is currently perpetuating this situation in Kenya.